My name is Kevin Finkel. I'm an anesthesiologist at IAA. I've been here for almost 9 years. I'm the fellowship director for the Hartford and Bone and Joint Institute Regional Anesthesia and Acute Pain Management Fellowship. I'm also the director of quality improvement for our department.
What led you to join IAA?
It wasn't until I came to IAA where I felt like it was the right fit for me. The things that I love about this is that it has a really great blend of academics and private practice, which is a rare trait to see in a group. And with that, there's a big focus on education, which I am a big proponent of. There's a lot of opportunities for research as well, which we've really developed quite a bit over the past few years. It didn't quite exist, it's something it's taken some time to build up, but having a clinical practice, a private practice like this with such focus on education and research is very unique. We have residents that come from the University of Connecticut anesthesia residency program. We have our student nurse anesthetist program, which is a fantastic program where we're training CRNAs. And something that's near and dear to my heart is the Regional Anesthesia Fellowship, which I started about 8 years ago here, seeing seeing the type of opportunities that existed with the amount of regional anesthesia that we do here.
Is IAA more academically or clinically focused?
I would say it's a really nice blend of both. It's a private practice group at its heart. We are focusing on, we work in busy community and tertiary care hospitals. We provide a quality service, but at the same time, with that, there's an academic flair to it, with education and research, teaching, the other thing too is that we put a big focus on. There's a lot of people who are fellowship trained in our group, so there's expertise training from many different locations that will come and conglomerate back into our group. So, for example, if you're on call and you have an issue with a patient who has a very sick heart, we have cardiac anesthesiologists who are on our group, who are fellowship trained in cardiac anesthesia. They can do a TEE for you, or give you just give you a consult, like a curbside consultation about that. We have regional anesthesiologists from about 7 different fellowship training programs. So you get different types of skill sets from different locations that come in and bring that back to us, and then we carry that on to our trainees as well. We have a pediatric hospital, the Connecticut Children's Medical Center, all staffed entirely by pediatric fellowship-trained anesthesiologists. I feel like this combination of specialties and focus on education and research is rare in a private practice group. But that's one of the nice things about IAA, is that it has that. And I have not seen any other groups, definitely not in Connecticut, but very few other places that I'm aware of that has this nice blend that is very desirable.
Can you describe the research at IAA?
We have a great research department here that is led by Dr. Azil Walker, and who is our senior project manager and clinical research coordinator, and Thomas Takata, who is another clinical research coordinator. Under their guidance and organization, we have a very large team of attending anesthesiologists, fellows, residents, and even college students, volunteers from many different locations throughout the country, and even in throughout other parts of the world, who are helping us. We have a team of over about 30 people who are working on it. We also have statisticians and medical writers that are assisting with these projects. So we have clinical research projects. I think about 20 or so ongoing research projects that have all been driven from the investigator-driven studies. And there's a lot of support in terms of being able to get IRB approval. We also have a good system in place for doing a lot of clinical trials, of a lot of like chart reviews, retrospective reviews through a lot of the data extraction from Epic. We have ongoing clinical research trials. We have randomized control trials. And there's a lot of opportunities. Each one of our fellows will start up and be involved with one of their own personal research trials. So it's really been quite a profound growth of the type of projects that we have and the infrastructure that exists that allows someone who's a busy clinician to come up with an idea and say, how am I going to make this better, or how can I research this, but actually have the resources and the facilities to go ahead and do that. That is something that is unique to IAA. That is something that is very difficult to see in other locations and other similar types of groups.
Can you describe the clinical environment at IAA?
Goal is to provide the highest level quality care. And we put a big focus on patient safety, patient comfort, establishing good relationships with the hospital administrators throughout our many different locations. But most importantly, making sure that the people who are part of our group, the anesthesiologist, the nurse anesthetist, the residents, the SRNAs, our PAs, our nurses, that they are proud to work in the place where they work, that they're happy. We, by being a privately owned independent group, we are able to make our own decisions. And if we see something that we see something that needs fixing, we're able to do that. And that's in contrast to some of these larger corporations where you're an employee. You're an employee that doesn't really have a lot of say. Whereas we are constantly putting out surveys to assess people's satisfaction. We're listening to what people have to say about it, and we want people to be happy and to enjoy working with us. And I think for the most part, that people really do like that. I love this job, and I don't even see this as a job. I see this as my, I had 2 jobs before coming here, but this is my first career. This is the place I'm going to leave here when I retire, and I think this is a place where you can really build up. You can make a name for yourself. You can come to work, and you can be part of you can start up a project. You can start up. For example, for me. So I started up the regional fellowship program. I don't think that would have been possible in many other groups. Be able to have the support, the infrastructure, and the willingness to grow that exists here. That allowed me to progress to make that, and it's been very successful. And it's been very everyone's been very supportive of that. That's one of the things we look for in somebody who wants to join IA. Somebody who wants to become more, who wants opportunity for growth professionally, academically. There's ways of making this a really great environment for anyone who wants to come in here. And I think that's what sets us apart from everyone else.
How has becoming a leader changed your perspective as a clinician?
Taught us the importance of succession and training people in other to take over for certain roles. And that allows for a lot of growth of new people coming in. There are plenty of groups where it's difficult to make any sort of stance, to take a stance and make any sort of growth being one of the new people. It's usually it's like a big board of older people that are there. That's not how it is here. Here we really emphasize and promote personal and professional growth. And the role that I'm in now, I try to find people who I think would be future leaders of this group. And the nice thing is that those are almost everyone is, because we really have high standards for the people we hire, looking for these people who are going to have the enthusiasm and the work ethic and the excitement when you come to work, and to be part of a growing system. And the other thing that I want to mention is that IAA has a very stable and strong relationship with Hartford Healthcare, which is, I believe, the largest healthcare system in Connecticut, if not the largest, one of the largest. And we have a very good relationship with them. We are at the majority of their hospitals, and as that healthcare entity continues to progress and grow, we are right alongside with them. And that's great for job security. It's a very good strategic partner to be a part of, and it's been very evident that has made a big difference in the ability of a group like ours to be able to grow and have a good partner to grow with.
How do you manage work-life balance?
I have a wife and 3 young kids and a dog, and the nice thing about our group, a group our size, is that when you leave, you can leave everything at work. You don't need to. You can leave your stuff and go home. I mentally check out when I'm home. We have a very fair system of time off. For vacations, it's a very fair system that is no different for somebody who's been here for 30 years versus somebody who's been here for 1 year. You get a fair system of that. There's a very fair system for relief order when during the week. And the other thing that really helps, I think one of the greatest things, is the call schedule, at least for the anesthesiologist, is incredibly predictable. So predictable that I can look out several years and know if I'm going to be on call a certain day of the week or a certain weekend. That ability to be able to look out so far and know when you're going to be on and when you're going to be off is incredible for peace of mind, for planning everyday events, and having that time to spend with my family. And so that's very comforting to me and my family, and to know that even though I'm very busy when I'm here, I'm able to keep it here and go home and be myself and be with my family.
What do you find most rewarding about your career?
I think what I find most rewarding is the ability to grow within this group. They've been very wonderful to foster personal, professional, and even academic growth. It's an investment in us. We reinvest. It's an investment in our members, in the anesthesiologists and CRNAs. I mentioned the fellowship program, but other things too. They've been able to promote me getting additional training in EPIC, our electronic medical record, and also leadership training, which I'm currently doing today, in fact. Being an oral board examiner for the American Board of Anesthesiologists. All of these extracurricular activities were supported and promoted by IAA to make me a better person, a better professional, which then in turn gets put back into the group, helps to raise the level of quality and for future people and the growth and expansion and the survival of our group, and it just makes it a much more rewarding career for me, as opposed to just doing the same thing day in, day out. The opportunities for professional growth, I think, is the thing that really I find most rewarding, and the thing that sets aside a group like this from everyone else.